Why are we here? Why are we here? Why are we here? There is undeniably a major pharmaceutical crisis in the world today. That crisis is considered to be counterfeit pharmaceuticals. Counterfeit drugs continue to flood our international markets despite strong efforts to stop them. The World Health Organization has now estimated that about 30% of the prescription drugs in the market are counterfeit. They also estimate that approximately $35 to $40 billion per year is spent on counterfeit drugs. Counterfeiting hurts the manufacturer, the employee that works for the manufacturer, and, most importantly, the patient. Currently, as much as 50% of pharmaceuticals sold over the internet are counterfeit. It is the anti-malaria drugs that are most often faked as the demand for treatment grows. It was once quoted by Bill Gates, president of Microsoft Corporation. It is a disgrace that the world has allowed malaria deaths to double in the last 20 years, when so much could have been done to stop the disease. The World Bank has also declared the malaria situation in Africa to be urgent, claiming the disease is weighing heavily on health systems. The disease is estimated to cost Africa more than $10 billion annually. And in Nigeria, malaria is blamed for approximately $1 billion in damage to the country's economy each year. This is not just a health issue, but also a development issue. So where do we go from here? And what is the solution? GLOBALPCCA and VTL, in their working relationship with NAFDAC, are proud to introduce the Improve Integrated Mobile Product Verification System, the solution to the drug counterfeit problem. Even though we have an excellent four-way authentication system, namely the Scratch and Text, the Scratch and Browse, the Scratch and Call, and the Scratch and Scan, referred to as the TBC and SCAN technology, but we wanted to do more. In the constantly changing world of counterfeiting, welcome to What's Next. The improved system involves the shipping of medications in a wide variety of packaging and packs with RFID tags and TBC and SCAN technology from manufacturers' plants to their distribution centers, wholesale facilities, retailers, pharmacies, and finally to end users, including the authentication and verification of documents. After consumers purchase a medication or product, they have the following ways to authenticate it: the Scratch and Text, the Scratch and Browse, the Scratch and Call, and the Scratch and Scan, at no cost to the consumer, and at no cost to the manufacturer or NAFDAC. Or they can use their pen tester, a testing pen, or the tray tester, a testing tray, to verify a green light that indicates go for good drugs or a red light that indicates stop for fake drugs. Green means go, and red means stop. It's as easy as A, B, C. You'll love this. Using our improved system ensures total protection for your medications from point of manufacturer to point of entry, to point of sale, and to the end user. That's you. Let's look at a few applications. RFID tags attached to immediate containers, secondary packaging, shipping containers, and pallets of drugs that are being placed into commerce. RFID tags are being used for inventory control, tracking and tracing of products, verification of shipment and receipt of such products, and finished product authentication. Instant authentication at pharmacy sensory points and NAFDAC enforcement teams using handheld scanners called the pen tester. The pen tester and the tray tester work in the same manner. RFID tags are applied to the drug package. RFID tags are authenticated based on silicon fingerprints. Encrypted parameters are sent to the pen tester or the tray tester for decrypting. Calculations of parameters are determined. Pre-programmed and expected challenges and responses are confirmed. Green says go, and red says stop. Utilizing core technology, silicon biometrics, and related technologies, RFIDs cannot be duplicated or copied. It is impossible for two chips to have the same silicon DNA. This core technology is currently being used in the U.S. Department of Defense, the U.S. Defense Advanced Research Projects Agency, U.S. Missile Defense, and the U.S. Air Force Research Laboratory. Other RFID users include Walmart, Pfizer, JCPenney, and GLOBALPCCA, just to name a few. According to research by the University of Texas in Austin, RFID technologies have already added $40 billion in benefits to the retail and healthcare sectors. These benefits have come from $4.4 billion in infrastructure investment in those sectors, implying a return on investment of over 900%. Overall, implemented correctly, manufacturers and pharmaceutical firms benefit from RFID in the following ways: reduction in counterfeit, shrinkage and parallel trade, efficient product recall, efficient sample management, enhanced inventory turns, enhancement of production par levels, shorter clinical trial cycles, faster time to market, protect the manufacturer's brand, regain and increase market shares, empower manufacturers to diversify product lines, reduction of production costs, track and trace that will cut down on overhead via real-time monitoring of fast movers or slow items. Distributors and hospitals will benefit from enhanced inventory turns, reduction in labor costs at the distribution center, hospital gain from better tracked equipment, tracking and increased asset utilization, enhanced inventory turns, increased access to healthcare, improving the quality of patient care through fewer medical errors, and reducing levels of non-compliance with medications. GLOBALPCCA, VTL, and NAFDEC are committed to working with you, the manufacturer, in developing and producing top-quality healthcare and pharmaceutical solutions that enrich, empower, transform, and save lives. Together, we can make a difference.